Indicated inside that the BPC is going to put out a statement today. What's the statement going to say, and why do you think it's important to put that statement out?
Well, I don't know if it's important or not, and it's just going to say what we said in June, and that is we support health care reform. Nothing dramatic, and we also acknowledge that mistakes have been made in the past. We're all guilty of not doing it earlier, and that we're no longer in the Senate. We don't have any vote or any power, but we have experience, and we're only trying to be helpful.
Now, you indicated Senator McConnell didn't think you were being helpful. Is that right?
At least he's trying to reach me on the phone, so that's a first. So anyway, well, I can understand if you're the leader, he may have a strategy that if everybody sticks together and they have a solid no vote, that the Dems will come around and say, okay, let's work it out. But so we don't care. We're not for any one bill. We're not supporting the Baucus bill, or we're just saying let's get health care reform.
But do you think your party wants health care reform, Senator?
Yeah.
Do you think Mitch McConnell wants health care reform?
Well, I don't know about
John
Mitch.
Boehner or
Boehner, I talked to him yesterday. He's going to have, House members are going to have a vote, Republicans, on a bill. So, you know, and they might, no, they probably can't prevail. They've got a 40-point deficit, 40-member deficit. But I think there will be a bill, and I'm not sure it'll be this year or early next year. There's got to be a lot of compromise made, even if they just ignore Republicans. There are a lot of Democrats who aren't very happy. And the blue dogs are still blue. They fade fast sometimes. But, and there are other Democrats who are running for re-election who kind of like their job. So I don't think this is much a partisan vote as this, for some, a survival vote. Because they want to stay in Congress, I assume, you know, make it their career. And Obama will have come and gone, and there'll be another president and maybe another one.
You seem to indicate in your remarks that you thought the Republican Party was being a little more obstructionist on this than you would like. Did I misinterpret that, or?
Well, I don't know if obstructionist is the right word, because Grassley's one of my best friends, and the Gang of Six, which he was a leader on our side, they certainly worked at it, and then something happened the last couple of days that kind of blew it up. But I think he and Baucus can still do business. They're both good, decent guys who want to get things done. But keep in mind, Iowa's a big insurance state in Des Moines, big insurance companies. And that's key to their economy. So I think the one thing where Republicans are right, we don't want to put anybody out of business, and neither do the Democrats. That's why some of the Democrats have problems with some of these votes.
We believe that the Senate Finance Committee, chaired by Max Baucus, among the 5 bills, is the one that has worked the hardest for bipartisan input, trying to find a middle ground for all of these complex issues. And certainly Senator Baucus has been open to input from the insurance industry to try to understand the consequences of various complicated changes. And certainly Senator Grassley from Iowa has been there as well.
But Tom, that bill is unlikely to get a single Republican vote, maybe Olympia Snow.
Which one?
The Baucus bill, when it goes to finance.
Yeah, it didn't get a vote. But I'm not sure what that signals. I mean, let's say they got 1 vote, what does that mean? Nothing. If they got 4 or 5 votes, I'd say they're on the way.
But they're not going to get that.
Not yet. You know, there's a long way between now and the time you get the final votes. You got the House, it's got 3 bills they have to patch together. You got the Finance Committee has to get together with the other committee, the Help Committee. So you got 2 bills there, and they've got the public option on all these bills except the Finance Committee. I don't know how they can do it. Harry Reid says he keeps putting dates out there and changing them. Not his fault. You just can't do it that quickly. I mean, they're not going to get, well, I'll get technical here, but when you get on the floor and start offering amendments, they're not going to be able to get 60 votes on all the amendments. They're going to have Democratic support, even if all the Republicans voted with them. So, but we need health care reform. That's everybody running around saying we not have health care reform. Pharma made their deal. They agreed to put up, what, $80 billion?
Yes.
Yeah, that's a lot of money, but they're sticking by their agreement. The insurance companies are the ones that kind of getting hacked here in the late stages with all these excise taxes. I don't assume they can't eat those. They have to pass them on.
They can't be passed on the way the legislation is
Yeah.
structured now, which will simply add to the cost of health care today, which is already high. We're concerned about that and have expressed our concern to Senator Baucus on that. On the subject of drawing more Republicans in, Dave, I think the president, as well as the Democratic leadership, very much wants to get a health care bill through the Congress this year. And as the senator has described these legislative compromises yet to come, I think that desire to get something done will create the give and take necessary to make it happen. I think it will be broader than that of just Senator Olympia Snowe. I think others will have to come across.
One more question,
Yes.
and I'll shut up, but
Well,
I guess, go ahead, Senator, I'm sorry.
Well, I mean, there's things they can do pretty like tort reform, some of those things, the way if you're going to set a trap, you ought to have something on the trap that's worth risking a vote on. And there are a number of things where Republicans, I think, would step over the line. We're not in the insurance industry's pocket, but we don't believe what they're doing to the industry. We don't want government takeover of everything in this country. But I think I'd like to say it is going to be bipartisan, which I say 12 Republican senators and 45 House members, just arbitrary. And I still think there's a chance.
What is the biggest obstacle in your view, Senator, to getting a deal done?
I think it's you've got the middle up there, which is probably going to determine what happens, and then you've got the right and the left, and you get into this public option debate. The liberal Democrats say the bill's not going to pass without it. Nancy Pelosi said she can't pass the bill without the public option. The so-called blue dogs, I'll get technical here, but so you've got everything kind of divided up, and nobody's been able to bring them together. Now, Obama's starting these White House meetings, which I think is good. Bring these guys down to the White House, and then ladies too, and sit down, and if it takes 2 hours, take 2 hours. It's pretty hard to turn a president down if he says, can you do this for me and for the country? It's pretty heavy lifting. And he started it, I think, this week, Monday.
And are you confident that it'll get done this year, or you don't see it happening this year?
It doesn't have to happen this year, but that pretty early next year because you're in the election cycle. And tough votes are always tougher the nearer you get election day. But I think Obama should get some of us who've had the experience just to sit around and shoot the breeze about health care and strategy, because, as I said in my speech, Obama hasn't had a lot of legislative experience, neither did Ronald Reagan. And Reagan was able to overcome it by focus on members. Take them up in the room and they'd have a drink or a cup of coffee. Or he'd tell them an old joke and they'd laugh and go die.
Worked a lot.
It did. And I think Obama didn't. He wasted a lot of time by letting all these committee chairs introduce the bill. He's the president. There should have been an Obama bill from day one. And so there are 60 days or more lost there. But now he said he's taken ownership now. It's his bill. And that's why I think, there's going to be some give and take.